Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Yeah, I mean, when you have the gravity of this totally new experience for you, where you, like you said, you're so healthy, you eat well, you're not taking
Yep.
ibuprofen,
Right.
and you have to reconcile, like, I'm
Yep.
voluntarily putting in like something we know we use it because it's poison. So
Right.
there's this
Right.
whole like, how do I reconcile? Like, I got to
Yep.
deal with that. And you got to watch it go in,
Yep.
and I don't know about your chemos, but many of them are pink, or they're colored in some way. So you see this like
Oh.
different color fluid that
Yeah.
looks like out of a sci-fi movie.
Yep.
And not only do you have to reconcile that, but now you have the social element,
Yep.
and so I mean, maybe tell me a little more like about that feeling of sitting down, preparing for the infusion, because I think that's probably, as you're mentioning, that pivotal moment
Yep.
of everything goes from hypothetical to real.
Yep.
And what advice might you give to other patients who are preparing for that day?
Yeah.
I love how you mentioned family.
Yes. I think, not everyone is fortunate enough to have a support system that's available to go with, but I would say if you can even just find a close friend or some individual that you are connected with who can come with you for every treatment, it makes a massive difference. Not only does it give you that support, but it gives you that distraction. I have never had a chemotherapy treatment without someone present that I know. And luckily, I rarely see that with other people either in the infusion room, because I would imagine that to be very lonely, and might make your mind go to a not so great place. So, like, having that distraction and support system is critical. And then, in addition to that, bringing the biggest water jug you can possibly imagine to your treatment, because drinking lots of fluid is like so critical. And for me personally, made my side effects and the whole experience so much less because I drank so much water. So being prepared with water, snacks. I have literally a bag that we now call the chemo bag. Like, have you got the chemo bag? And it's water, snacks, coloring books for distractions. At my infusion center, we have amazing volunteers who come around to do arts and crafts with you. And so, just as many distractions as you can have in terms of making things as normal as possible, even though you are in this room getting chemo administered, the better. Because I think if you don't have those distractions and you don't carry on drinking and eating like normal, you're going to fixate on the negative so much, and you just don't want to go there.
Yeah. And then, to your experience, so you're in the infusion chair, infusion starts. What do you feel immediately, or do you feel anything right after?
I felt nothing other than, because I was on steroids, I was like super amped up. Because the steroids amped me up. Um, you'll laugh at this because you know me pretty well. Within 30 minutes of having the infusion, I was like, okay, I'm going to go for a walk. So I'm now known as the lady who walks in the infusion center and does laps with her chemo attached to her. That's just what I do. And so I just make it part of my activity when I'm in the chemo room. Because again, like, I want to be distracted. Movement makes me happy. I don't want to sit in a chair and just fixate. So walking up and down the infusion center is what I do.
I think that's great.
Yeah.
And so you were mentioning steroids, and to the folks listening, we use steroids to calm down inflammation. And these are corticosteroids, not like anabolic steroids that you use to build muscle. That's a very common source of confusion because we use the same term for both. But these are not steroids we're giving to get Samantha all buffed up.
I
But
wish they were.
I mean, if it's amping you up, you can get some push-ups out there. Yeah, I endorse it.
Exactly.
Yeah, use that
Exactly.
energy. What are some of the other things that you see other patients doing that might be helpful for those listening to plan ahead?
Like I said, having a chemo bag, whether you call it that or not, I think is a really good preparation tool. Having your favorite snacks, having your favorite book, maybe if you like reading, and you don't want to do laps in the infusion center, um, just having those creature comforts. I'm a 38-year-old woman, but I still love, like cuddly toys. So I sometimes take I have a dog, German Shepherd, and so I have a lot of cuddly toys that are like German Shepherds. And so sometimes I'll take a German Shepherd toy with me that I can snuggle with. Just kind of any home comforts. Like if you like sewing or knitting, take that with you. So yeah, just any comforts that make you feel calm and at peace. I think the better, to be honest with you, because you just don't want to get into that spiral state.
Yeah, and you're talking about, emotional distress.
Yes.
And I think there's a really big conception that, people are clutching a trash can while infusions are going in.
Hmm.
Is that something you experienced? Did you see that in other people?
I had no side effects during my treatments. Other people I saw might have like allergic reactions or whatever, and little alarms would go off and people would all run over and help them. So I had seen that occur quite a bit. The infusions also make this, I don't know if it's just my center, but if there's air caught in the line or it gets um knotted or whatever, it will make this really awful noise, which makes you sound like you're flatlining on a heart monitor. And that would happen to me all the time because I'd be moving around and flailing my arms. And um, so those are kind of honestly the two most common things that would happen in the infusion center is people would have like an allergic reaction or yeah, their lines would get cut off. But that's about it. I mean, I did see a scary episode once where a guy, I don't know if it was his first infusion or not, but his body just obviously couldn't tolerate it and they had to just stop. But what was reassuring to me is the nurses in the infusion room are so on it. I have never seen nurses so on it in my life in terms of just, they're literally like anything you feel that is different to just daily life, tell us immediately, no matter what it is. If it's a tingle, if it's, your heart feels a little bit faster, like anything, you have to tell us. And I hate being that person who's like, excuse me, I
Yeah.
have a problem. But luckily I never experienced any of that. But they were very, very on it. So what I will say to people is like when you're going in to get your infusion, whether it's your first or your 72nd infusion, like the nurses know what's going on. They've done these infusions before. You're not the first patient that they're administering this drug to. And like, you should feel confident that you are being really well looked after.
Yeah, and those, infusion reactions, a lot of times they'll happen with immunotherapies. That's a different class of medicine than chemos. But there are very, very clear protocols that we have. A lot of times if someone's having a reaction, we stop it and actually things just get better.
Yeah.
So I think the mindset of I'm going to be there really, really sick is probably, it's from that previous era of chemo when
Yep.
people were getting really high doses of really toxic stuff. And it's just not that common anymore that people get really, really bad reactions like they did in the past.
Yep.
And when we do get either some allergic reaction, it is very, very rarely that anaphylaxis that we worry about, like going into shock or anything. I can't remember a time that I've ever encountered that. Um, so usually it's, someone will feel heart rate will go up, they'll get kind of warm, maybe, a little lightheaded, breathe heavily, and we're able to fix that. We have medicines. So even in the worst case scenarios that are likely, there's always a very rare chance of something really severe. But in the likely things that we see, the nurses have protocols that they go to right away, and they're experts at spotting all this. When I get a page from a nurse about a patient having an infusion reaction, they tell me what it is and they tell me what they're going to do. And I'm like, yep, that sounds right. And then they know exactly what to do. So at any place that's giving infusions with any regularity, you can rest assured that you're going to be in good hands. These are really, really well characterized side effects.
Yep. And
And
I know we'll get to this, but I was forewarned that all the medicines they were giving me now, as soon as they start to wear off, that's when the symptoms of the chemo show themselves. So I know we're going to get to that, but
I think now's a good time. So,
yeah.
I think a lot of people have the conception of side effects, but in your experience, what were the side effects of chemotherapy?
Yeah, so I had two different chemos. I think one was more hard on me than the other one. So honestly, the first round of my chemo, I had zero side effects, like nothing. And I became kind of arrogant about it, where I was like,
Doing
see,
laps around the unit.
I'm
Yeah.
good. Yeah, like, because I was told that the symptoms. So for me personally, I was given nausea meds that would last 3 days, and then I was to do steroids for a couple days after my treatment. And so when that all wears off, they were like, that's when the symptoms take place. And like they gave me nausea meds and everything to like make sure I stayed on top of my nausea if and when it came. But my first round, I had nothing at all. I mean, I was hiking, I was working out still, no nausea, nothing.
And when you say
And my
first
second,
round, do you mean
yep,
the first infusion you ever had
sorry,
or
yes.
your first
So,
type of chemo?
the first, what I call the first round would be my first infusion with all of my chemos together.
Gotcha.
Um, and yeah, I guess we should explain that because a lot of people say, I'm on my fifth round or I'm on my sixth
Yeah.
round, and people probably don't know what that means. But a round to me, anyway, and tell me if I'm wrong here, is
Yeah.
like your infusion that you get every X weeks is a round.
Yeah. Yeah. We use
Yeah.
the round cycle you might hear.
Okay.
Yeah. No,
Yep.
same. They mean the same thing.
Okay.
And, but when someone has to change therapy for whatever reason, that number will start over. So you might have
Yes.
7 cycles of one chemotherapy, and
Yep.
then you would go on to cycle 1 of the next one, just for
Yep.
people to understand that nomenclature a little bit.
Yeah, and I'm realizing round almost sounds like a boxing match, like first round
Yeah.
and second round. Here we go again, third round. But yeah, so first and second round for me, I actually had no side effects. But what I was told is the specific chemo I was on, and this is obviously different for everyone depending on what chemo you're on, but had a cumulative effect. So the more chemo rounds you had of this chemo, the worse the side effects would get. I don't know the science behind that. Maybe you can explain that, but I was told like, yeah, you're probably going to feel okay first round, second round, third round, oh boy. And that was pretty accurate for me. So third round, oh my goodness, the nausea was wild. And my taste buds changed. So I suddenly could not look at a plate of meat without feeling violently ill. and I weirdly could not eat tomatoes or
Huh.
tomatoes, depending on where you're from. Um, I don't know if it was because of the acidity or what, but I could not do tomatoes anymore. But the nausea meds helped keep keep it at bay as much as it could do. Um, but I would love to know from you the effect of multiple rounds and it kind of getting worse and worse. What's the science behind that?
Yeah, put basically, it's that your body acknowledges that this is a toxin and it affects the center that
Mm.
in your brain that perceives something to be toxic. So when it comes to nausea, that cumulative effect, that cumulative effect is really just it being in your body for too long.
Gotcha.
Um, and we see this with other side effects too. And after we hear more about the side effects you have, I can go on to what other people sometimes experience. But that theme where the longer you're on it, the side effects kind of increase over time for a lot of people. And it's not always. I've seen people on chemotherapies for a very, very long time and they do just fine. But for most people, there is this cumulative effect with a given side effect, and it could be, one of many types of side effects. But yeah, it's your body not being able to tolerate a toxin for all that long. In the same way that, you know, drinking alcohol over a long period of time has a cumulative effect. Smoking over a long period of time has a cumulative effect. Chemotherapy is really no different.
That makes sense. Um, so yeah, I was trying to be the person that never got side effects, but that wasn't a thing. So yeah, my third round wasn't pleasant. The other thing in addition to nausea was just fatigue. I'm a very active person and I was fortunate enough where I was never like in bed per se, like during the day, but I wanted to still hike. I still
Yeah.
wanted to like get out there and do activities. And it felt like my body weighed like 100 pounds more than it did. And every movement was a struggle. And it was like fatigue I just can't explain that I've never experienced in my life. It was just like I am trying to move with sandbags attached to myself or something. So that was pretty hard, but again, it was only a few days for me every round after the third round. So it wasn't like this debilitating
Mm.
amount of symptoms. And what I've learned through talking to different people who have done exactly the same treatment, that every single person is different. Like even if you talk to someone and get or multiple people and get their advice on side effects, you can be guaranteed you're likely not going to get the same side effects as them or to the same degree or for the same length of time. Everyone is so different. And I wish we knew the science behind it because I'm just genuinely curious on why that is. I don't even think it's a matter of because I'm healthier than you or not. I don't think there's a correlation between the healthier you are, the less side effects you're going to have. I don't think that's the case at all. And I don't know the reasoning. Maybe it's because I never had ibuprofen or Advil or
Yeah.
anything my entire life, so my body could handle it. I don't know. But I was very fortunate compared to some people that I know you're going to talk about it, like other people, but um, some people can be bedridden and
Yeah.
it's very jarring and debilitating and mentally very hard. Because even when I was having symptoms, that weren't that severe, but they were just symptoms I'd never had before. It was like, is this the cancer or is this the chemotherapy?
Yeah.
And that is a constant mind mess for me going through treatment is okay, is every literal feeling I have in my body the cancer getting worse, or is it the chemotherapy doing what it's supposed to do? And the more rounds I had, the more I could correlate themes. And so then it would make me feel a little better of like, okay, well, my lung tends to hurt on day 5 every time I have chemo. So I know it's the chemo, just kind of making it inflamed and raw, so to speak, and not my cancer being angry. And my liver would, interestingly enough, have a few aches. And that would always be on like day 7 or 8. And I had dramatic shrinkage in my liver during this time. And now I associate that with shrinking of tumors. But like, that was just me learning different parts of my body reacting in different ways to the chemotherapy. So the more you're on a treatment, you can kind of learn and understand that, okay, this is what the chemo is doing. These are my side effects from the chemo, and it's not the cancer.
Yeah. And when you were saying, it began to be predictable that after a certain day you would get really bad fatigue or your nausea would come up. Just, how frequently did you get chemo? Like, how much time are people looking at least, or were you looking at where you were not feeling really well, and then how much time in a given cycle or round were you able to do what you want to do?
I had chemos on Thursdays. And what I will say is that when you're planning out your chemos, you might not necessarily know your side effects right away, but when you get familiar with it, and if you're still working, as an example, and you learn your side effect days, you can then schedule your chemo to an appropriate day that might work better for you than another day. And so what I mean by that is, I have my chemos on Thursdays, all my medicines would wear off, and my worst days would be Monday through Thursday of the next week. Well, if I maybe had a work where I had to physically go in and do stuff and I couldn't take time off, I would have timed those 4 days over a weekend, right? So I'm not losing as many days off work, as an example. So I was fortunate where it was just 4 days every time. So not that crazy. My infusions were every 3 weeks. Okay. So I would have 4 days of just feeling like meh, as I would call it. And then I would be back to Samantha, I'm back at it. But I would know that once that Sunday night came around, oh, it's coming.
Yeah. Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.